Hello. I wanted to take a few minutes to share with you briefly some of the key provisions of the House Republicans' proposal to replace the Affordable Care Act. We're fortunate, or maybe unfortunate, living at a time when history is being made. And it's critical that as nurses we are aware and informed about the provisions so we can make appropriate interactions with the consumers and policymakers and other regulatory agencies to ensure that nursing is well represented in these changes. Now, what are some of the major provisions? I'm going to just review quickly. Is that the enforcement of the individual mandate. So no longer will it be required that you have to have health insurance. What has stayed in is that there's going to be a 30% surcharge, so that if you did have health insurance, you dropped it for whatever reason, and then you want to come back in, they can charge you up to 30% more as a penalty fee. This is an incentive to keep you in the program. So what has also been eliminated from the program is the employer mandate on large companies to offer affordable coverage. Currently, they are required to provide health coverage, and this has now been eliminated. Also out is the tax credits based on income, age, geography, and other factors that benefit lower and moderate income people buying coverage through the Affordable Care Act marketplace, and this will end in 2020, so there is a little bit of a phase-in. What is proposed is the tax credits based on income and age for buying their own health insurance sold in their state. It's an age-based sliding scale with those from 20 to 29 receiving up to $2,000 in credits, and those that are 60 and older up to $4,000. There are limitations on your income levels and when these subsidies cannot be used. They also cannot be used by any plan that has abortion coverages. And it can be used for any plan in states that are approved to offer plans, including ones providing only catastrophic insurance. So that means that individuals could elect to only have catastrophic coverage and not have the routine plan of care that is currently under the Affordable Care Act. Insurers can charge customers up to elderly customers up to 3 times a higher premium than they charge younger customers. This has been eliminated. The change is now up to 5 times. So insurers will be able to charge older people 5 times what they charge younger customers. Out or eliminated is that individuals can contribute up to $3,400 and families up to $6,750 in a pre-tax health savings plan. Now this has been eliminated, and what is being proposed starting next year in 2017, individuals can contribute $6,550 and families up to $13,100 in pre-tax money. So an incentive for folks to save out of their incomes for their health savings account. Out are the cost-sharing subsidies which were provided to insurers to help their Affordable Care Act customers cover deductibles and co-payments, and those are all scheduled to end in 2020. And in a replacement is the states would receive $100 billion over 10 years through a new patient and state stabilization fund for patient safety needs and possible high-risk pools for consumers with expensive medical conditions. Now, in regards to Medicare, the Medicare as an entitlement program with open-ended matching funds for anyone who qualifies is out. What the substitute is, or a suggestion is, the Medicare will be funded by giving states a per capita amount or a block grant based on how much each state was spending for the fiscal year that ended in September. So under the current Affordable Care Act, there are 31 states out of the 50 who have expanded Medicaid coverage to provide care to these lower in poverty income level. It's basically 138% of the poverty income level provide them health insurance. Under the GOP plan, they will still receive funds until 2020, but after that they will only pay them 90% of that cost. So so beginning in 2020, beneficiaries will be, the states will receive money at a lower rate. And as of 2020, also all provisions for substance abuse and mental health services would be eliminated. Now, in terms of some other factors, they are keeping the provision that if you have a pre-existing condition, that will continue to be covered. Dependent children can be under the parent's plan until age of 26. And that there is no caps on lifetime amounts of money that you spend on your health care. And they still have to have a certain specified benefits plan as currently with the Affordable Care Act. And that they can no longer discriminate. They kept in place the provisions on the basic federal discrimination. As you know, for now, though, the transgender or issues related to gender identity and termination of pregnancy are no longer covered. And of course, as I mentioned before, Planned Parenthood is no longer can receive any funds to provide primary care, which they provide a significant amount. They've already been prohibited from using federal funds for abortions. So those are some of the major differences. Now, the Office of Budget and Management came out today. This is March the 13th, on the impact of this GOP proposal, and they're substantial. And I'm not going to go over it tonight, but I encourage you to read up on it so you are aware of the provisions. But the bottom line is, this American Health Care Act, by the numbers, but 14 million Americans will lose their coverage in 2018. That's just next year. 24 million Americans will lose coverage by 2026. And lastly, the other major change is that seniors are going to be charged up to 5 times more in premiums than folks that are younger. So I encourage you to read more on this proposal, and as you're doing your discussion questions, be cognizant of the fact of what impact this proposal may have on the question that you're being asked, and do some of your literature reviews to address this, because as nurses we need to be informed consumers as well as advocates for both our patients and the public at large. So give it some thought, and let's see some of your reflections in your policy and healthcare comments as you move forward with your weekly postings.